Good day, everyone. I am Onyekwuo Uchechi Precious, a 100-level healthcare management and nursing science student of the Joint Professionals Training and Support International Institute of Management, Science and Technology in collaboration with the South American University, USA, Global Wealth University, Togo, Pan American College, California, etc. I'll be giving a brief presentation on the presence of hepatitis B envelope antibody in patients who have been previously diagnosed of the surface antigen. Now, what is hepatitis B? Hepatitis B is a life-threatening liver infection caused by the hepatitis B virus. This virus invades the liver and interferes with the functions of the liver while replicating in the hepatocytes. The immune system is activated to produce certain reactions in order to combat with the virus and possibly eradicate it from the system. Now, as a result of pathological damages, the liver gets inflamed. Some of the symptoms of this virus includes abdominal pains, fever, joint pains, jaundice, dark urine, vomiting, loss of appetite, and weakness. Now, what are the ways of transmitting this infection? This infection can be transmitted through sharing of sharp objects. It can be also transmitted through giving blood transfusion that was not screened. It is also transmitted from mother to a baby at birth. It can also be transmitted through having unprotected sex. Now, what are the ways of preventing this infection? This infection is best prevented through vaccination. The vaccines are taken for 3 to 4 doses within a space of 6 months. Now let us go ahead to talk about patients screened for the hepatitis B surface antigen. What is hepatitis B surface antigen? Hepatitis B surface antigen is a protein from the hepatitis B virus. This virus is found in the blood of the infected person. Now, patients are screened for this hepatitis B surface antigen in order to determine if they are infectious of the disease. A positive test of this, along with certain other antibodies, shows that the person is infectious of the disease and can transmit it to other persons from their blood and other body fluids. Patients are also screened for the hepatitis B envelope antigen. Now, the presence of this hepatitis B envelope antigen in patient serum indicates hepatitis B virus infectivity, number of infectious virions, and the presence of hepatitis B core antigen in the infected hepatocytes. Also, the presence of this hepatitis B envelope antigen and the absence of the envelope antibody usually indicates an active hepatitis B virus replication and a high level of infectivity. Now, in conclusion, hepatitis B virus is a life-threatening infection which can easily be prevented by taking the vaccine. The presence of hepatitis B envelope antibody in patients who have been previously screened for the surface antigen denotes the loss of hepatitis B virus infectivity. This means that the virus has stopped replicating and the patient is successfully recovering from a previous hepatitis B infection. On the other hand, the presence of hepatitis B envelope antibody in vaccinated patients indicates that the person is protected against the hepatitis B virus as a result of receiving the hepatitis B vaccine. And that will be all for my presentation. Thanks for watching.